Dr. Vin Gupta now, NBC News contributor, affiliate assistant professor at the University of Washington. Doctor, thanks as always. Cases, hospitalizations, deaths, all going down, thank God. Things are looking up. But could this be a mirage? Are you personally still concerned about the more contagious variants that are potentially causing a spike?
Shep, good evening. Cautiously optimistic is what I will say, and as are most in public health. Right now, the variants themselves, the ones identified overseas, have not caused the surges that we were expecting potentially by now, although it's perhaps too early to say. And number two, I'll say, Shep, we don't have the sequencing capability, the fancy laboratory technology that you need to actually see, are these variants here? Maybe we're just not detecting them as often. We don't really know what we don't know, or the technology that we lack to really understand the true prevalence of these variants. So I think right now we still need to be very cautious in how we think about this good news. We still need to be vigilant. But yes, this is really good news, light at the end of the tunnel, hopefully by midsummer.
Sure hope so. The study from which we got data over the weekend in Israel shows that the Pfizer vaccine actually stops the spread of COVID. How big a breakthrough could that be? Is that potentially why we're seeing numbers go down?
So the data out of Israel is fantastic, and it's mirroring what we're seeing in states like Connecticut, for example, Shep, which is showing that if you get these vaccines, Pfizer, Moderna, frankly, Johnson & Johnson, that these vaccines will keep people out of the hospital, will reduce death rates, and that is ultimately what matters. The data on transmission, though, is very, very interesting and is the type of data we need, because what we would like to tell people is, hey, if you get a vaccine, then you can go start to normalize life. Right now, it's a tricky balance. We're telling people get the vaccine, but because we don't know if all vaccines stop transmission, please mask and distance. That's a hard message to sell. Some don't like hearing that, and that's been the difficult rub here. If I may, I think your team has a few CAT scans I want to show your audience. And this is what these vaccines, all vaccines, Shep, do. We need to encourage confidence for all vaccines that are effective. And all the approved vaccines right now, whether it's AstraZeneca in the UK, at least, Johnson & Johnson, we hope in the next week, Pfizer, Moderna, they prevent progression of your lungs from left to right. That right-sided image is severe pneumonia that requires life support. All the vaccines in the pipeline are approved, will prevent that from happening, regardless of the variant. And the reason I'm saying this, Shep, is people are now saying, well, maybe I want the Pfizer vaccine instead of Johnson & Johnson or a different one. That's the wrong way to think about it. Brand here doesn't matter. Get the first vaccine available.
And get it the second you can get it. I know I will. Dr. Gupta, thank you as always. Shepard Smith here. Thanks for watching CNBC on YouTube.